So today we'll be discussing about chemical injuries to the eye. Chemical injuries produce extensive damage to the ocular surface and the anterior segment and can lead to a severe amount of visual impairment. Chemical injuries constitute to about 8 to 18% of all the ocular injuries. Most victims of chemical injuries are young, with exposure occurring in industrial accidents, at home, and in criminal assaults in some cases. What are the various modes of chemical injuries? So they can be domestic accidents which can be caused by disinfectants, detergents, and some amount of cosmetics. So all of these injuries can happen at home. Next is agricultural accidents which happen with the use of fertilizers, insecticides, and some amount of toxins. Laboratory accidents are also pretty common, which commonly happen because of acids or alkalis. And the last type is a deliberate chemical attack, so where a person throws acid on an individual with the intention of causing bodily harm to the individual. This phenomenon is called as vitriolage. Severity of ocular injury depends upon the type of chemical which is going to cause the injury, the concentration of the solution, duration of the exposure, surface area of contact, as well as the degree of penetration. So these chemical injuries are broadly classified into alkali injuries and acid injuries. So what are the common alkalis which can cause injuries to the eye? They include ammonia, which is a common ingredient in household cleaning agents, lye or sodium hydroxide, which is a common ingredient in laboratories and drain cleaners, lime or calcium hydroxide, most common cause for alkali injury. It is an ingredient of a mortar and a cement, and it is not said to cause very severe damage. The other agents include potassium hydroxide and magnesium hydroxide. What is the mechanism of action of alkali injuries? Now, alkalis dissociate and saponify fatty acids of cell membrane of tissues and destroy their structure. Being hygroscopic, which is the ability to extract water, they extract water from the cells which contribute to the total necrosis. They combine with lipids of cells to form soluble compounds which produces softening and further gelatinization of the tissues. So these are the mechanisms of action of alkalis. Next we'll talk about the acid injuries. One of the most common acids to cause injury is the sulfuric acid. It is a common ingredient in automobile batteries. The other acids include sulfurous acid, hydrofluoric acid, acetic acid, which is seen in vinegar, chromic acid, and hydrochloric acid. The most common acid being sulfuric acid. What is the mechanism of action of these acids? Acids cause instant coagulation of proteins which act as a barrier, thereby preventing deeper penetration of the acids into the tissues. That is why injuries with alkalis are said to be more dangerous when compared to acids because of the coagulation which happens in the acid injuries, which prevents further penetration of the acid and further damage to the tissue. So acids are said to be little less damaging to the eye when compared to alkalis.